Hi, my name is Vicki, and I'd like to welcome you to Building Health with Vicki. I'm going to talk to you today about what dysautonomia is and what can be done to improve the symptoms of it and what can be done to help heal it. I am not a doctor, and so uh, this is not medical advice. This is just what little educational things that we've learned about dysautonomia on our journey. So please do your own research and talk to your doctor if you have any questions about this. All right, now dysautonomia. The easiest way for me to tell you what it is when your parasympathetic nervous system and your sympathetic nervous system are not in balance, right? They're supposed to be able to turn on and then go back down and turn off, turn on and turn off. When it gets where it's just stuck, where you're always tipped toward your sympathetic nervous system, which is your fight and flight, and you don't have the opportunity for the rest, digest, and healing to happen with your parasympathetic nervous system. You're not able to chill for things to work right, like digestion. It can get stuck, and that tends to happen. It can just happen. A trauma could make it happen. Another thing that can make it happen is a virus or a disease, or alcohol could cause it, diabetes. So there are a lot of things that could cause it. It's something that's been more prevalent since COVID has come into the picture. So before it was, there were some people who were dealing with it, but it was not near as pervasive as it has become, or well known at least. So I gave you a little, a crude definition of it. And so now I want to take you into just what I've read a little bit on the internet. Dysautonomia is a condition that affects the autonomic nervous system, a part of your peripheral nervous system. The autonomic nervous system regulates the involuntary function of many of your internal organs, such as your heart rate, respiratory rate, digestion, urination, palpatory response, and sexual arousal. This system has two branches: the sympathetic, as I said, which is in charge of fight and flight response, among other things, and then the parasympathetic, which controls the opposite body responses. For instance, imagine that your life is threatened by a wild animal. You should run right. Yep. As a response, your sympathetic nervous system is what prevails, and the other one is like down, like you're not going to go to the bathroom, you're not going to have any thoughts of doing a lot of things during that, because it's just you're trying to stay alive. If this it does this to redirect oxygen flow to your muscles for the purpose of running or fighting if necessary. Now imagine there's a dysfunction in the system and your heartbeat increases while you are watching TV or merely standing up. Simply put, this is an example of what people with dysautonomia experience. And I apologize, I don't know what the dog is barking. Probably deer. It's that time of night. So now I'm going to go into some of the symptoms. And also Parkinson's disease is another disease that it mentions that can happen from this. And now the symptoms are palpitations, like your heart beating really fast, which can really make you feel weird and anxious. Then another thing is, let me slide here, dizziness, which makes sense. Okay, and fatigue. All right. Constipation or diarrhea could happen. And then cold feet and cold hands. And with that, something called Raynaud's, where, the color that my hands have a little pinkness to it. But when you have this, they could turn as white as my shirt. And the first time I saw that, I just took a picture of my daughter's finger because it was so weird to see a finger totally go white. And it's important that it warms up, that she moves around to try to get blood flow there, or puts on like gloves, because if it stays like that for too long, it can actually turn black and you could get gangrene. Not something that we've ever gotten close to. It's only turned white, but something to watch out for. Most of the blood goes right to your vital organs with dysautonomia, and it can make it where you're not getting the blood flow to your peripheral areas like your fingers or your toes. Swings in body temperature. We haven't seen the swings as much as hot and cold, but we have to watch out that she doesn't overheat. But mainly she's cold. But her temperature has been on the low side. Like instead of it being 98.6, it's been more like it was 95 for a while, quite often. And then it would get up where it would finally get up to like 96.8, which some people run lower, but it's healthier for it to be up a little higher. It helps your body fight off things. Let's see. Then brain fog is another symptom, and which makes sense. And part of this is because your legs, your body automatically, when you stand up, your muscles in your legs automatically, without you thinking about it at all, they squeeze, and it pushes your blood up toward your brain so that you can get good brain, blood in your brain and blood flow. So that doesn't happen, and which can be really frustrating because it can make it hard to think, to learn, to focus, and it can affect people in a whole lot of ways, socially and in learning. Then the other one is feigning. And did we experience this for a while? That was kind of one of the first signs that we had, is she would just nearly pass out. I'd see her going out. And I'm so sorry that dog won't start barking right now. But and again, that's because of not having adequate blood flow to the brain, and it can cause confusion too. And so when it's been at the very worst, which was when we were in Savannah, Georgia one time, we were on vacation going from Florida, and then we went up into Georgia on our way home, and wanted to spend some time there. Didn't get to do a whole lot because when she'd start to walk, she would just start wilting, and I was having to literally just pull her up as we walked, and finally found a fire station where she could get her blood pressure checked. And it was low, but it wasn't low enough that we had to go to the ER. It was just almost. Blurry vision can be an issue. Exercise intolerance, which is a crazy thing with this too, because if you don't exercise, it will get worse. It's really important that you have strong muscles in your legs. And fortunately, Casey does. She's been awesome about being willing to do like the elliptical, going for walks, and doing a rebound. So she has amazing legs muscles, but that helps the tightness of the muscles helps to keep the volume of blood going up to the heart and to the brain. Then I think that covers the symptoms that I wanted to go over with you. Now I want to talk to you a little about POTS was part of it. I didn't cover that. So let me see. POTS is posterior. Let me look at it to make sure I'm saying it right. That's it. Postural orthostatic tachycardia syndrome. Okay. Postural, like your posture. And then orthostatic tachycardia, your heart, is one of the symptoms, which is POTS. And that's become a lot more of a problem since COVID as well. But that is, anytime you have a disease, that is not like for hers, it just wasn't diagnosed for so long. So that's what took the toll on that. Now, I want to hit the things that you can do that can help. One is compression socks, okay, and or garments, like even like using a t-shirt, like a Spanx like shirt, to kind of push in on could help. And we've done that for a while. Another is tilting the bed, putting it a little bit of an angle so their head was up a little bit. We did that for a while. Then some other things we've done. Oh, lots. Okay. Starting the day off with a teaspoon of salt and a glass of water and drinking it and keeping the volume of fluids really high. That's another one. Let me see what else. Something that we found that's helped that I learned from a doctor, a cardiologist on TV, he has just IVs, just fluid IVs that he gives his patients. Well, that really wasn't available, but because Casey has had some issues with her B vitamins not being where they needed to be, we've been able to get IV infusions, and those, her getting an IV helps to boost her blood volume, and that can make her feel a lot better. For like some people it only helps for a few days, but for her it really seems to make a difference for like a week or two or more. So that's something that we've been able to do that's helped. I'm trying to think if there's anything else. I can't think of anything else right now that we've done that was really helped with POTS. Oh, other than things that are high magnesium, like avocados, tend to help her. And what else? Those are the main things. Oh, and we've finally got into Vanderbilt's Dysautonomia Clinic, which she's now on a medication. And I'll put what it's called in the notes, that she takes that can be used to help raise the blood pressure. And she takes that. We have to do her blood pressure on a pretty regular basis to make sure that we see how it's working. And she takes that 3 times in the day, and that raises her blood pressure, and it really makes a big difference. Her getting on the elliptical and going or running, in the yard a little bit, or the rebounder, that really can help. And it also helps with the vagus nerve, which is involved in this. And I'll go into more on the vagus nerve later. Let's see. I think that's all I have time for now, but I wanted to say thank you so much for joining me. If you have any questions about this, or anything that you've learned that you want to share about this topic, please feel free to join in and mention in the comments, and subscribe and share with somebody if you know that they're dealing with this. Hope you're having a great day. Thank you.